All right, Madam Chair, we are now live and you have the floor.
Good evening to everyone. I welcome you to the Pitt County Board of Commissioners June 7th virtual meeting. Welcome to all. Um, and at this time, I will call the Pitt County Board of Commissioners meeting to order. Madam Clerk.
Yes, good evening. Chairwoman Floyd Huggins,
Here.
Vice Chair Fitzpatrick,
Here.
Commissioner Albright,
Here.
Commissioner Colson,
Here.
Commissioner McLaughlin,
Here.
Commissioner
Here.
Hunt,
Here.
Commissioner Williams. Here. Commissioner Ward,
Present.
Commissioner White.
Here.
Everyone is present.
Thank you. We will have a moment of silence for the lives of all those that we've lost due to violence and gun violence and COVID, illness, and then we will have invocation. Lord, we thank you for this day. We pray for our students, those who have moved up in grades, and especially our graduating seniors. We pray that we and the schools have provided them with the necessary tools that they need to pursue their dreams. We pray for understanding of one another. We pray for love for one another. We pray for patience. We pray for peace here in Pitt County, North Carolina, and the world. And now I pray for your guidance for us as we make decisions for your people here in Pitt County. We thank you. Amen. And now we'll have the Pledge of Allegiance. I pledge allegiance to the flag
Of the United States of America
and to the republic
and to the republic for which it stands,
one nation,
one nation, under God, indivisible, with liberty and justice for all.
That was by myself. And now we will have approve of the agenda, but I believe we have some changes to it. So, Mr. Manager.
Yes, Madam Chairwoman, we neglected to put a report on there from Dr. Silvernail. So if we could, under items to report, make a number 2, that'd be Dr. Silvernail's report on COVID-19. And if the board would indulge us as well, the item for discussion dealing with face coverings in in-person meetings, I'd like to propose moving that up right after his report, since some of his information will have bearing and light on those 2 topics. And that's all I have.
Okay. So now entertain a motion to approve the agenda with those additions. Commissioner Nunley.
Motion.
Madam Chair, move to approve with that modification.
Okay. I have a second?
Second.
Okay, it's been moved and second. It's been moved and second that the agenda stands approved with those additions. Are you ready for the question? Madam Clerk?
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes.
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.
Okay. Thank you. Mr. Manager, do we have anyone sign up to address the board?
No, ma'am, nobody is registered with the clerk of the board at this point in time unless she tells us otherwise.
Okay. All right. We will. No one signed up, so we will move to the next item, and that is your item for report, the manager's report.
Okay, thank you, Madam Chairwoman. So a few things to report on. We've got the meeting dates. Obviously, the public hearing on the proposed operating budget will be tomorrow night at 6 p.m. That will be a virtual type of meeting, again, for the board. Then 2 days later, on Thursday, the 10th, we have the, hopefully what will be the budget adoption that night. Then otherwise, June 21st will be your next regular meeting, which is the third Monday in June at 6 p.m. The NACO conference, just a reminder to the board members who are going to be attending that conference, either virtually here in Greenville or attending the conference, that is July 9th through 12th. As part of that conference and as part of this report, we applied for a NACO Achievement Award, and that's the National Association of Counties for the public listening. And we have received this award, and it is for our community paramedic program. So we will be recognized at this national conference for this program. We got a press release that has been sent out describing the program, describing our partnership with Vidant Health on this, the foundation, and the service that it provides to our citizens here in Pitt County. So we're proud of that, and we'll hopefully bring back that award for you to see once we attend. I would like to recognize in the course of actually applying for that award, our planning department, led by James Rhodes, actually spearheaded taking this bull by the horns and writing the application. He was heavily involved in the All-America County designation, and he was able to task him to take some of that material and retool it into the NACO Achievement Award. So I'd like to give him the credit and thank him for his work on that. Otherwise, on the next item, we've got a workers' compensation settlement. This is basically to report out that we've settled this case, and basically we've settled a disputed claim with the employee through mediation on April 7th. It was in the amount of $7,500, and that's just to enter that into the record for that purpose. On item E, another thing that we're proud to report, and I think we've got a picture we want to display on the screen, but one of our own, Kelly Andrews, who is our soon to be, well, she's currently the PCDC Economic Development Director, but she will soon be coming in a few weeks on July 1, the Pitt County Department of Economic Development. She was recognized by Business North Carolina, which is a statewide magazine, on their supplemental publication called Power List 2021, North Carolina's Most Influential Leaders. You can see in this category of economic development, Kelly Andrews was listed with a number of peers across the state. She was just one of a few in Eastern North Carolina who was mentioned, but we're very proud that they saw it fit to recognize her from the role she's played in Pitt County and what she does for us. So congratulations to Kelly. Item F, the Bells Fork Convenience Site. That is one of the sites that we are going to be paving. We had hoped to start that paving project this week. The site would be closed 5 to 7 days. Unfortunately, the rain is playing tricks on us. We couldn't get that started today, and with the way the forecast is looking through the week, it may be delayed a week. So, but we want to make you aware if you receive any complaints or just comments about that site. That is the site that is out there across from the Alice Keene Park Complex. In terms of recycling, so this is an update regarding ECVC and recycling operations. As you're aware, we've had some discussions, many ongoing discussions with ECVC. We had reported to you on our meetings with ECVC regarding recycling. There were some things that we were seeking as information and actually as a one more effort in trying to have a dialogue with ECVC. Brian Barnett and myself actually went out to ECVC, met in a small group setting with Lisa Ross and Jason Thomas to go over our requests one more time and actually put them in writing to them. And through a good long discussion, very, very productive discussion, we're pretty much in agreement on all the terms of what we're seeking. Some of the stuff through their, what they call their dashboard, they're going to retool and include that information there. The information that they want to keep proprietary or confidential, we've set up a quarterly meeting where we're going to meet face to face and go over all the information we're seeking. And we feel like that this is a real good outcome on this. They're also proposing to, within the existing agreement that we have for the MRF, the MRF Materials Recycling Facility, they're proposing that that MRF agreement goes through 2026, that we look at some type of rebate scenario, that if the commodities are selling good, that we would be credited either quarterly or biannually to a rebate scenario. So we're going to be proposing some language to come back before you as a board to amend that contract, hopefully. And also, the last part of this is at the end of the current fiscal year, which is coming up June 30th, once they've closed their books out, we'd like to bring ECVC and the recycling operation before you to give you a year-end report, and maybe also possibly at that time to further talk about the contract amendment. But we're as staff, we are pleased to say that I guess our impasse has been done away with, and we're all in agreement now to moving forward. Just got a couple of other items real quick. I think Dr. Silvernail is going to hit this on his report, but the Pitt Partners for Health is doing a health assessment survey. That's all I'm going to say on that. He's going to be asking for participation. We sent this out to the board. We're asking our citizens of Pitt County to fill this out, but I believe he's going to hit this on his report in just a minute. Two other items real quick. Just would like to do a shout out to our interim PIO, Public Information Officer, Carla Hansen. She's been holding the fort down since our PIO Mike left a couple months ago. She will be transitioning to another role within the organization in a couple of weeks, but she's done a great job in running the operation for our PIO office and all the things she's done. So we would just like to for that. The last item is just a quick mention. County has a current service contract with Piedmont Service Group. It's set to expire June 30th. This is a comprehensive contract that covers all of our HVAC needs, whether in our office building, courthouse, so on and so forth. We're proposing to have an RFP process, a request for proposals. We don't want to launch that until probably into first quarter and the second quarter of the fiscal year. So we are going to execute a 6-month extension, do that process, and then we'll bring back to you the results of that RFP process. And Madam Chairwoman, that's all I have. Thank you.
I see Commissioner Nunley's hand up.
Thank you, Madam Chair. Thank you, Scott. On the ECVC, the items that they deemed proprietary are, you mentioned directly after that they would be providing some of that information that wouldn't be public. I'm not sure if I understood you correctly, but would they be providing that to us in a confidential closed session, or to staff in a confidential manner, so that the board can be apprised of that information? What were the items that they deemed to be proprietary?
Well, proprietary is my word. I don't want to put words in their mouth. There were items that they felt like that as a private nonprofit that they were willing to share with us as staff. I would imagine that if it's something you want, well, I don't even know if it's closed session eligible. I don't think it would be. But when they come before you, say in July, August, probably be the first meeting in August. Again, the information we're going to receive will help justify knowing the per tonnage fee that they charge is in line, and whether it needs to be increased to the same, decreased, whether we should get that rebate credit, so on and so forth. So I hope that answers your question. Maybe not.
Well, I mean, so I guess I had a number of questions that I wanted specifically answered back when we raised it. One was regarding what the employees are paid, what their hourly rate was, and what sort of treatment and what percentage of revenues that come into the nonprofit actually go to the employees and toward their mission, and how much of that goes to administration. That's specifically really what I want to start to look into a little bit with anyone we do business with that has a mission-driven, mission-driven, I guess, line. We want to make sure that we're trusting but verifying that that when taxpayer dollars go to support a mission, and which is in this case a very, I think a very persuasive one, that we make sure that the folks that are being held up, that they're getting a fair shake, and that's what I'd like to have confirmed.
But I don't think they're willing to basically say how much they're paying their employees, and some of the information that, whether it's their budget information on expenditures and revenues, they're willing to share with us. So when we make a recommendation to you as part of budget, just like we're doing tomorrow night as we bring that budget forward for a public hearing, that you can be assured that our staff recommendation is based upon sound information and advice. They're basically saying they're not a public entity, thus they're unable to open their books per se, because they're not a public entity.
Right.
And that might be something that I would feel more comfortable in ECVC maybe addressing when they appear before you, to maybe, so I'm not putting words in their mouth per se in my responses on their behalf.
Sure. And I may be alone on this. I haven't spoken to the other commissioners about it, but I do feel like it's important that the people that are on the ground that we contract with, that they're fairly compensated. And, I understand that their position is they're a private nonprofit. It's a tax designation, but they're receiving public dollars to provide a service, to be a commodity trader. And I want to make sure that the folks that we're paying them to have in place are getting a fair shake, because otherwise, I wouldn't feel good about it if they're not getting a fair employment package and they're being taken advantage of. I'm not saying that they are, but again, this is a trust and verify situation, and I think it's kind of part of our diligence every year when we look into who we're contracting with. I think this is something we ought to look at. How are the employees being treated? I don't think we should shield ourselves because we hire a third party. I don't think we should shield ourselves and close our eyes to how the employees of those third parties that are providing services are being treated by the entity that we're hiring. I'll leave it at that, but that's just my point.
Okay. Well, again, I think I'll defer to maybe let them, they appear before you to maybe take off from what I've said, or correct what I've said, or add to it.
Well, thank you, Commissioner Nunley. I understand what you're saying, especially about caring about the employees, that they are not making sure that they are compensated. I see a hand from the PIO. Is
Commissioner McLawhorn had his hand raised. Just wanted to make sure you saw.
okay. Is somebody from PIO wants to say something? Ask a question.
Just that Commissioner McLawhorn had his hand raised.
Oh, okay, that was it. Oh, all right. Okay, Commissioner McLawhorn.
Thank you, Madam Chair. Commissioner Nunley raised some very valid points, and certainly I serve on that board, ECVC, and I think Scott alluded to the fact that there's some certain things, because they're private nonprofit, and there's some measures that they do not have to disclose. But I wanted to refer that to, just for a moment, if I could, to our county attorney to see if would there be any challenge to that. But I think I'm comfortable with the report that we've been getting. But if I'm missing something, Scott and Madam Chair, could you elaborate on that a little bit?
Well, the additional information we're seeking, which they've agreed on 2 levels to provide to us, whether the dashboard report or the quarterly face-to-face meeting report, will help us as staff feel comfortable in the recommendations we make to you in terms of the tonnage fee. Keep in mind the $100 per ton fee they charge us to process the recyclables is about 28% of their revenue in income stream. So their other revenues are either coming from the commodities they sell, or it's coming from being propped up possibly by the other operations of ECVC to cover the costs of the overall operation, depending upon how they are going year to year.
Are we comfortable with what we're receiving from the reports that we get from ECVC as it stands?
Well, when we'll be meeting for our first quarterly meeting. Brian, I think we said, what was the date on that? Coming up in, I think,
July 27th.
pardon me?
July 27th.
July 27th. So we want to report back to you on the first meeting in August. I think it's August 2nd, possibly, or that first Monday, whatever that first Monday is. And we'll be able to tell you that hopefully everything I've explained to you here that they've agreed to, I feel sure that we will be where we need to be.
No, okay. Thank you. Thank you, Madam Chair.
All right, thank you. Commissioner Albright?
Yeah, just real quickly, I would want to add that it seems that we certainly ought to be able to tell what percentage of the money revenue is being spent on admin and on employee salary and those sorts of things. And that seems a pretty basic with every nonprofit I've ever looked at. And I hope that we're already getting that. And if we're not, that we would get that clearly, whether we get the individual pay or not. But that seems really essential here. And I appreciate Commissioner Nunnally bringing it to our attention.
Okay, thank you. Scott, I want to go back to something that you reported on. I want to say thank you to James Rose for his work on the awards program or that. And did you say that Carla is leaving us?
Yeah, well, Carla is taking a position in emergency management. I believe she starts Monday the 14th, if I have my dates correct, June 14th. But she will still be, and actually as part of this, we actually have a new PIO, Dawn Jones, who will be starting on Monday the 14th. We'll introduce you to her on June the 21st at your next regular meeting. So a lot of changes in the PIO office. I think Carla is going to be a team player and has agreed to kind of help out in the short term while we recruit people to help Dawn Jones build her staff. And we are also another shout out to Kyle Kettler. He is actually has turned in his notice today because he's taking a job at the town of Gardner, I believe, and he's already moved there with his wife. Been there quite some time. Matter of fact, I think he's actually working tonight remotely, like everybody else. And thank Kyle for his 4 years of service to Pitt County, and we'll be seeing a lot of changes in the PIO office, and are looking forward to some new faces and good things forthcoming.
Well, I certainly want to thank Carla and Kyle for their service, their work here. They've really been helpful to us in our meetings, helpful to me. So really, and congratulations to them, each one of them. Thank you. Now we'll move to the second item, which is Dr. Sibner.
Yes, ma'am.
Good evening, Madam Chair. Good evening, Commissioners.
Good evening.
Let me share my presentation here, and so I can show you some numbers. There we go. So June 7th already. Time flies when you're having fun. We'll start out. We'll talk about vaccinations first with you. As of midnight last night, there had been 72,055 first doses given in Pitt County. There are 66,607 fully vaccinated individuals in Pitt County. 40% of our county population is partially vaccinated. 37% of our county population is fully vaccinated. So we're making progress. Vaccine uptake is slow, but we are making progress. If you follow the data on a day-to-day basis, you may have noticed that on last Wednesday or Thursday, there was a big jump up in the percentages. And that's because the default on the dashboard did not include vaccines given in the federal pharmacy program. And they have since adjusted the dashboard so that the default includes those vaccines. So we saw about a 7% jump in vaccinations Wednesday or Thursday of last week without a clear explanation for why, but I pressed the state on a call today and they said, well, they changed how that dashboard fed, so it includes those vaccines as of this time. We look at this from an equity standpoint. African Americans have received 29% of the vaccines given in Pitt County. They, as a percentage of our population, are about 37% of our population. So we continue to lag about 8 points with African Americans. At one point, that was as high as 8.6 percentage points behind. We have closed that gap some. We continue to work with our community partners to reach out to African Americans and get them vaccinated. We have several offsite clinics I'll mention as we go further into the report, but we are working with our Hispanic or Latinx group. At one point, we were 2.5 percentage points behind with them. We have reached a level that places us even with their proportion of the county population. So as of today, they're considered 0% behind. They are caught up, and that's good. And it's an easier group because they're a smaller group. So each member of the Hispanic or Latinx community is a larger percentage of the group. So it was a little easier to close that gap than it has been with African Americans, but we continue to work with both of those. By comparison, whites are 60% of the Pitt County population and have received 60% of vaccines in Pitt County. So they are 0% ahead or where they should be. So overall, I think we should be pleased with that. Again, we are working to close the gap with African Americans, but I think we're up against that hard resistant core of vaccine hesitancy for lots of different reasons. As we broaden the base of vaccine providers and get this into private physicians' offices, I think that'll help us close that gap, but we continue to work on it as well. Put the slide in my press conference last week. This is really aimed at the public, not the commissioners, but whether you have spots or not, you can get your shot. Try to say that 3 times fast.
Okay.
COVID vaccine is widely available in our community. Most of the pharmacies have COVID-19 vaccine. The health department has it. Vidant has it. ECU physicians has it. The ECU mobile team is still working with us and independently to reach out and get people vaccinated. So please consider getting the COVID-19 vaccine, folks. So I really say that for our community, not so much for the commissioners. Clinics this week, we have multiple offsite clinics this week. The details will be out by noon tomorrow in a press release. We are back at Cornerstone Missionary Baptist Church to do booster shots and first doses. We will be at Jarvis Memorial one day this week, again, to do booster doses and first shots. We have a clinic at Triumph on Friday, I believe, jointly with the Beaufort County Health Department. We'll both be there giving vaccinations on Friday to reach out to that side of our county and the western edge of Beaufort County. Kind of a good joint operation for both health departments. And the details of those operations will be out in writing tomorrow in a formal press release. So I think that's good.
Dr. Silvernail, when you said booster, you mean second shot?
Second dose, yes, ma'am.
Second dose.
Second dose or booster dose, yes, ma'am. When we look at our, oops, sorry, was there a question? Moving on to look at our Pitt County case data, we continue to improve. I think sometimes it's easier when you look at a point in the past and look at where we are today. So for the commissioners, I choose the last meeting that I presented at, which was May 3rd. At that point, we'd had 533 cases over the previous 14 days. That was a rate of 38.1 cases per day. As a rate per 1,000 residents, we were at 2.9 cases per 1,000 residents. Our total cases were 19,377, representing about 10.5% of the Pitt County population. Our estimated recovered at that time was 18,758, representing 96.8% of cases. We had accumulated 86 fatalities to that point, and our case fatality rate was 0.4. Our percentage of tests returning positive were 7.2. I would mention that positivity rate is a 14-day rolling average. So if you have a high day in that 14 days or a couple of high days in the 14 days, it takes 2 weeks for them to pass through and move out of the averaging for that as a simple unadjusted average. This is where we are today. Over the past 14 days, we've had 260 cases. That's about 18.6 cases per day, 1.4 cases per 1,000 residents. So about half of where we were at the start of last month. Our total cases today are 20,325. That represents 11% of our Pitt County residents. Estimated recovered, as of today, I would estimate that 19,969 of those cases are recovered. That's 98.2% of the cases being recovered. We have in the last month accumulated 10 additional fatalities, although that has been steady for the last week or so now. The state had gone back through and reviewed some cases where data was available and had reclassified some, and there have been some additional too. So we've gained a few there. I would mention that while 96 fatalities is certainly a significant loss, our estimates for fatalities in this were far, far greater than the number that we've had, thankfully. Our case fatality rate is stable at 0.5, unrounded 0.47. And our percentage of tests returning positive are 6.2. Again, when I look at it on a day-by-day basis, there's some days where we're down around 2% positivity, but if you've got a couple of high days in there, in that 14-day rolling average, I have to wait for them to roll out before it really is reflected fully in the averaging. So still a little higher than we would like, but definitely improving since last month. I want to show you a couple of curves to bring the epidemic to you visually. This is the Pitt County epidemic curve as a stacked bar graph. This blue color, at least blue on my screen, slate blue, are individuals who don't live in a congregate living setting, think long-term care facility, nursing home. The orange or salmon color at the bottom represents individuals who do live in the nursing home. So here's the start of the epidemic pandemic last March. You see we rose, here was our first outbreak in a congregate living setting, up to our summer plateau, the ECU spike of late summer, our fall plateau, and then climbing towards the January peak, down to a nadir at the end of March, and then climbing through our spring wave. And it now appears that we are on the backside of our spring wave. When you look at this, if you go to, this is the week of December 5th, this would be the week of December 14th. This is when vaccines became available. And in the federal program, vaccination began in long-term care facilities. By mid-January, second doses were being given to many of those residents. Some of that stretched out through the end of January, beginning of February as people got around to those facilities. But by mid-February, the number of residents with COVID has just kind of vanished. And I think that's largely due to vaccinations. While we are still seeing staff members, unvaccinated staff members, acquiring COVID in some of these facilities, we're just not seeing much activity in terms of the residents, because most of the residents in these facilities have been vaccinated. So I think that's really shows the triumph of vaccines over COVID in that graph. I'm going to say at the start of this, I don't speak for Vidant Health. I do occasionally steal graphs from Vidant Health, and this I did steal from Bill Cleve, the hospital epidemiologist, the public health epidemiologist for the Vidant system. And this is from a report Bill sends out every week, comes out on Tuesday. So this is last Tuesday's graph. And again, you can see the epidemic curve, and this is for the whole Vidant system. This blue line represents those cases that were admitted to the hospital, and you can follow that through and see, again, we're sort of on the backside of the spring wave, it looks like, in hospitalizations. I think the interesting thing here is that early on, the admissions curve, this sort of black or dark gray curve, and then the lighter gray or silverish curve, that the three lines were fairly close together. They separated fairly rapidly, and this line of folks in the ICU has remained relatively flat throughout the epidemic. And the number of folks on ventilators has remained relatively flat throughout the epidemic. And I think as time has gone on and providers, physicians, nurse practitioners, PAs have become more comfortable treating the condition, and we've had therapeutics come on the market for the condition, our ability to keep people out of the ICU has grown. You can see even at the height of this, where there were over 250 people in the Vidant system, there were 56, I think was the height of their ICU caseload at one point. So about 1/5 of them in the ICU. I think that's great news going forward, that these therapeutics are out there, that we have growing experience and feel more comfortable managing these patients when they do need hospitalization. This last graph, excuse me, not graph, but graph, shows our testing throughout the epidemic. And you can see back in March of last year, very, very limited ability to test. We grew through the spring and the summer, the amount of testing we could do, reaching a height of almost 10,000 tests at the peak of the epidemic, and falling off to where we're now finally just below 4,000 tests per week being done in the county. But even though the number of tests being done is down, it's because of demand being down. The capacity has been built to do a great deal of testing in the county if there were a need to do the testing. Many private medical practices have the test available. Vidant has a tremendous ability to run PCR tests, something on the order of 5,000 tests a day. The commercial labs are doing it. We're still able to obtain samples when we need to through our laboratory. We do that on a very limited basis these days. But still a fair amount of testing going on in Pitt County. So I think that's all good news from the standpoint of where we are in the pandemic. Want to move on. Commissioner Floyd Huggins had asked me to update you all about the Say Yes COVID test project. I want to remind the board that Pitt County was the first jurisdiction in the nation to have this program. Officially, the program is over. Their data collection is over. In total, there were well over 20,000 test kits distributed by Pitt County Health Department and our numerous community partners. So again, let me say thank you publicly to our community partners here in Pitt County. Very helpful in terms of getting them out. And they range from Pastor Coles to the school district to other churches, other businesses that were all willing to help us distribute these kits to their clients or their employees, customers, things like that. So really was a great community effort. We still do have some test kits available. As the program was ending, they allowed us to order an additional 1,000 kits, and we still have some of those test kits available. We are still distributing them on a day-to-day basis. Any interested Pitt County residents can pick up a test kit from the health department while supplies last. And then as Scott mentioned, the last thing I'll talk about with you, just so that you are familiar with this, is something called the Community Health Needs Assessment. This is from a public health law standpoint. The health department's required to do this every 4 years at a minimum. The Affordable Care Act requires the health care systems and hospitals to do this every 3 years. In 2018, Vidant and many of the Eastern North Carolina counties piloted and did a regional community health assessment that allowed the counties to get the data they needed to do their individual health needs assessment, but also to produce a regional health needs assessment. And that same strategy is being employed this time as we go forward with this. So again, this is being done as a regional project this year involving 30 Eastern North Carolina counties. Counties can add specific questions to the standard questionnaire that has gone out. Pitt County, we have chosen to do some virtual focus groups. We feel that's a good way to obtain additional information about areas of concern in our community. The survey is open to the public at this time. I believe we've sent that link out to Scott and to everybody. It's been sent out to the county workforce. We're looking at other avenues to distribute that as well. We know that males tend to be poor in responding to this, so we are looking to try to get more males into the sample to balance the sample out. And the results will be presented later this year when that work is all completed. But it's a great project that involves the health department, the hospital system, East Carolina University, Pitt Partners for Health, a number of other entities. And really, it's truly a regional health assessment, but able to give county level data as well. So looking forward to us presenting that data to you later this year. And that's the end of my formal remarks. I will stop my share. And if you have questions, happy to take your questions at this point.
See Commissioner Nunley's hand up.
Thank you, Madam Chair. And thank you, Dr. Silvernail, for your continued diligence and help getting the message out about vaccines in our community. And I wonder, as we're reflecting back on where we are as a community about, running into the vaccine hesitancy, from a public health perspective, what are some things that you feel, and maybe just we can brainstorm on it, but things that we can be doing in the community to make sure that we're counteracting the misinformation and the disinformation that seems to really spread rampant in the communities and in various circles. so that not just this crisis, but the next one, we're better prepared.
Yeah, Commissioner, thank you for the question. I think one of the things that we struggle with in many aspects of public health is perceived risk. Demographically, we're a younger county, and many younger folks do feel that they are at low risk from the infection. And I think that that has raised some, well, should I get the vaccine? Should I just ride this out? And we are working, we know that many of these folks are sort of the young working adults. We know that that's where the burden of disease remains in the county. And we're trying to make that convenient. We've worked with several employers to get vaccines into the workplace and get their employees vaccinated. We have found that going to, now that there's enough vaccine, going to a no schedule clinic where we can, people can make an appointment if they want to, but if they just want to walk up to one of these clinics, whether it's an offsite clinic or a clinic at the health department, and get their vaccine, that's making it more convenient for them. So we're trying to get out in the community, remove those barriers, and make it easy and user friendly for folks to get the vaccine. And every chance I get to speak to somebody about the vaccine, whether it's the commissioners meeting, our board of health meeting, our weekly press conferences that are still going on, I try to answer those questions and get that message out there.
What about a partnership with the schools and our health programs? I'm just thinking vaccinations generally. There just seems to be a growing hesitancy within not just our community, but maybe it's perceived, but there seems to be a lot of disinformation generally that spreads. Is that an area we can explore, maybe looking at advocacy within our schools, so that as younger people do, so that they're better able and better equipped to know where and how to receive the best information regarding the science behind the medicine of vaccines?
Absolutely, Commissioner. Dr. Lenker and I have had some discussions already about bringing some of that vaccine to the school. We would need parental consent in the school district, it's felt, to be able to administer the COVID vaccine at the school district. He expects to have some students in Pitt County schools over the summer. I know he was anxious just to get to the end of last week and through graduation and end the school year. But we've had those discussions with him. We know that not only for COVID vaccines, but for other vaccines, that many of our Pitt County school children are behind on vaccinations. We were running some drive-through clinics for that last year, in addition to our COVID operations. And once the state extended it and kind of took the pressure off of the students to get vaccinated, our demand in those clinics just fell off. So we know that I definitely prefer the carrot over the stick in public health, but there probably does need to be at least a hard stop on some of the vaccines, the non-COVID vaccines, to get folks through the door. And then that would give us the opportunity to give the COVID vaccine as well. I have heard that Moderna is going to be getting an approval down to age 12 as well. It has not received that approval yet, but I understand that is forthcoming, and that'll make a second vaccine available to that age group. And again, hopefully, the more that it's available, the more that it's normalized, the more that it can just be given. And then we would also encourage our local pediatricians to do that. And I've had some conversations with at least one of them. He felt that over half of his patients would likely take the COVID vaccine once it was available for that age group.
Thank you.
Okay.
Oh, you're very welcome, sir.
Okay. Well, I don't see any other hands. Dr. Silvernail, thank you again for bringing us the information, and thank you and your staff for what you do for the citizens of Pitt County.
Thank you, Madam Chair. I'd also like to echo the manager's compliments for the Public Information Department. I will tell you, they have stood shoulder to shoulder with us throughout this pandemic. Before Mike left, Mike, leading the team was great. Carla did a great job leading the team and working with us and just being with us side by side throughout this response. So thank you to Carla and Kyle and the newest member, Ryan, for all the hard work they've done.
Yes. Thank you. Next item, items for consent.
Madam Chairwoman,
Yes.
we had discussed pulling up item number 8 under discussion,
Oh, yeah, that's right. Oh, I'm sorry. Yes. Item number 8, you're gonna discuss that with
Sure.
Dr. Seminaire, or is gonna add to it, or what?
I'll take a stab, and then it's really a joint presentation for myself, Dr. Silvernail, and then our county attorney, Janice Gallagher. So the two things this covers is the face covering policy into place well over a year ago. And at this point, our joint thinking of the three of us, and I don't think either one will speak up, they're more would like them to, but with the Governor Cooper's latest easing of the associated restrictions in this area, we believe that this policy is no longer needed within our operations. If you look at our employee survey, I think we had 16% say that they had experienced having COVID. We've got about 73% who say they've had been fully vaccinated with the vaccine. Now we have about 1,000 employees in Pitt County. 543 responded to it. So if you were to take those numbers and extrapolate them, you can take that into consideration. The other thing about moving to the second component of this, in-person meetings, we are proposing that the board go back to in-person meetings effective immediately. However, we would like to have the board consider doing this, but have it still do social distancing. So if the Board of Commissioners met for the first quarter of the fiscal year, July, August, September, meet at the Ag Center, social distance, you wouldn't be masked, but social distance. And then maybe by the second quarter, beginning September, we could be back in the board's meeting room on the dais and meeting in that manner. So Dr. Silvernail or Janice, I don't know if you want to add anything to what I've just said or if I've missed anything.
This is Janice. I don't have anything in particular to add. I just defer to Dr. Silvernail's recommendation as to the need for the safety measures with regard to social distancing and the ability to relieve us from the masking requirements.
Thanks, Janice. I would mention that we are, public health is carved out, at least in terms of our client-facing side of it. On the governor's order that we still are required to be masked in terms of our waiting room, client-facing services, clinical services, and public health. Healthcare, the school districts were carved out, and masking was still required in there. I suspect that will change by the fall. The Board of Health would like to go back in-person meetings and wanted to do so where we could spread out a little bit, just for everybody's protection. Distance is really probably the best defense against this. And we felt that getting in our conference room would not allow for adequate spacing. So we're planning to do the same model that we've suggested for the Board of Commissioners next month at the Ag Center in terms of an in-person meeting, but allowing for social distancing in that in-person meeting. The masks, I think masks do reduce transmission in some settings. They don't reduce transmission in all settings. We are doing well in the community at this time with generally pretty low rates of COVID. So I feel comfortable with the rescinding of the masking ordinance at this point in administrative areas, as I said, other than the areas that are carved out by the governor's order. And happy to take questions if you have questions.
Mr. Nunley's hand is up.
Thank you, Madam Chair. I have to say, I'm so impressed and proud that when the survey came back, that we're showing 73% fully vaccinated rate at our county. And, if we're reading, a lot of, and Dr. Silvernail, you can correct me if I'm wrong, but I'm reading a lot of sources that, 70 to, if you're anywhere from 70 to 80%, the risk of, rapid outbreak spread that's a danger to the community, that's severely limited when you've got populations that have 73 to 80%, 70, 80% vaccination. And so I just, I feel like our county has stepped up, our employees have stepped up and really done their part to get the shot. And, I think that taking the masks off would be a great thing, and getting back in person would be a great thing. And it's just due to those, and everyone taking that individual responsibility, and I'm just very thankful.
Thank you, Dr. Silvernail. At the beginning of this, we took your directives on the ordinance, and we are again taking your directives on rescinding it. So we really thank you, and we look forward to moving forward with the recommendations. I see Commissioner Albright's hand.
Yeah, is it appropriate to make the motion to rescind?
Yes, sir.
Yeah, I'd make that motion.
Okay. I heard somebody.
It's Mike. I'd like to second the motion.
Okay, thank you. It's been moved and second that we rescind the ordinance of face masking. Are you ready for the question, Madam Clerk?
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes?
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Absolutely.
Motion passes unanimously.
Thank you.
Madam Chairwoman, there's a second part to that, and that would be to move to in-person meetings while practicing social distances. And we're saying as feasible in terms of that practice. So we could really need a motion on that as well.
Okay.
Madam Chairman,
Yes.
I would like to make a motion that we do, resume our face-to-face meetings with social distancing, and I feel like we could probably do it at the Ag Center without any problem, and that would be what I would recommend unless the office feels like there's some, a better way. And then I don't want to set a date for us coming back together in the conference room, because I think we can decide that when we're in our open meeting.
The manager has laid out what that would look like. Okay.
Yes, ma'am. Yes, Madam Chairwoman, if I can add, for the June 21st meeting, I think we've already have some things advertised. We need to do that virtually. If we can make it be July, effective with the July meetings moving forward to be in person.
Yeah.
Yes, that was what I was saying. So I'll put that in my motion.
All right. Commissioner Perkins Williams.
I second the motion that was offered.
It's been moved in second. Are you ready for the question? Madam Clerk.
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes?
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.
Thank you. Now we'll move to items for consent. Entertain a motion.
So moved,
Madam Chairman,
Chair.
I'm acceptance of items for consent.
Okay. Been moved in second that items for consent be approved. Are you ready for the question, Madam Clerk?
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes.
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.
Thank you. All right, we have item 9 for decision. Social service. Scott, do you want to say something before Jan?
Yeah, I think Jan is on the call, I believe.
Yes, I'm here.
All right. You on?
Okay, so I'm here tonight to ask you to approve the contract for in-home services that are funded by the Home and Community Care Block Grant here in Pitt County.
We have published that we were accepting bids for our in-home services funded program. And that publication was February 18th through March the 19th. This would be a 1-year contract with potential for 2 renewals of 1 year each. The bids were opened at the Social Services Board meeting on April 13th, and we had 3 bidders. The bids were reviewed. The 3 bidders were Interim Home Health Care, who bid $16 an hour, which was an increase of 75 cents over their current rate. Bartes Enterprises, who do not currently operate a home health agency, bid $19.40, and Bayada Home Health bid $18 an hour. Zoom interviews were set up with each agency using questionnaires, very similar to the ones we've used in the past. And so our staff participated in the review process. Interim has had the contract since July of 2015, and wanted to make sure that you were aware of that. We followed a thorough review. We did some reference checking, and with all of that, we are recommending Bayada as the contractor for the coming year, with the option to renew for 2 additional years, 1 year at the time. We felt that they demonstrated a very strong commitment to both the clients and their staff through the information that they provided to us. So I'll start with what questions people have.
It appears that you did your due diligence with this process. I see Vice Chair Fitzpatrick's hand.
Motion to approve.
Second.
Okay, it's been moved in second that we approve the contract to this provider that's proposed by Jan Elliott, Social Service Director. Are you ready for the question, Madam Clerk?
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes.
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.
All right, thank you. Commissioner Perkins, your hand is up. Is there something? Is that?
Nope, I tried to put it down. I was going to second it, but it was one of those fly by night motions or so. I don't, there we go.
Thank you. Thank you. We'll move to the next item, Scott. Next 3 items. Scott.
Yes, ma'am. So this item is concerning the NACO conference coming up in July 9th through 12th. Your board travel policy normally allows for 3 commissioners to attend per the rotation policy. And we've got 3 who are signed up to attend. And we've got 2 additional that would like to attend. And due to the fact that we've had limited to no travel for the past 12 to 18 months per se, we as staff are recommending that the board allow the 2 additional board members to attend in person. And then anybody else who wants to attend, they can attend virtually as well. But we polled the entire board, and so staff recommendation is to allow this additional expense.
Commissioner Fitzpatrick.
Motion to approve.
There was somebody on the phone that's.
Second.
Okay. It's been moved in second. Are you ready for the question? Madam Clerk.
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes.
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.
Thank you. Scott, you're up again with the.
Okay. So on your next one, the reappointments to the Pitt County Agricultural Advisory Board, it's being recommended to reappoint Chad Smith, Steve Sutton, and Commissioner Lauren White.
Madam Chairman.
Madam Attorney, since I'm up for reappointment, is it appropriate that I recuse myself from voting on this?
You may vote for yourself on this matter. That would be
Okay,
fine.
well, if that is okay, then I would like to make the motion to reappoint.
I second it.
Oh, okay, all right. It's been moved in second that we approve the appointments as noted. Are you ready for the question? Madam Clerk?
I'm sorry, Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes.
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.
Thank you. Next item, the appointment to the Convention and Visitors Authority. Scott?
Yes, ma'am. You have a recommendation from the city of Greenville to recommending the appointment of Christy John. And this is a person who represents as a hotel operator.
Commissioner Fitzpatrick?
Motion to approve.
Okay. Nunley?
Second.
It's been moved in second that we approve this person for the Convention and Visitors Authority. Are you ready for the question? Madam Clerk?
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes.
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.
Thank you. We'll now move to commissioner comments and committee reports. Commissioner Colson? You have comments?
I have none.
Commissioner Fitzpatrick?
No comment.
Commissioner McLaughlin?
No comment.
Commissioner Albright?
No comment.
Commissioner Ward?
No comment.
Commissioner Nunley?
No comment.
Perkins Williams?
No comment.
And Commissioner White?
I would just like to take a minute to congratulate Kelly Andrews. She's worked very hard for Pitt County. I know that we're all very proud on her on that award that was so well deserved, for that recognition that's so well deserved.
Okay, thank you. I wanted to congratulate her too, kind of. Thank you. All right, at this time, if there are no other comments and I did not miss anybody for comments, we will move to a closed session. Madam Attorney?
Yes, thank you. Good evening. It has been suggested that this board go into closed session pursuant to North Carolina General Statute 143-318.11A6 to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee. Also under 143-318.11A1 to prevent the disclosure of confidential information, and additionally under North Carolina General Statute 143-318.11A4 for purposes to preserve confidentiality with regard to an economic development matter. With that, do we need a motion?
I will entertain a motion.
Motion to go into closed session, Madam Chair.
Second.
Been moved and seconded that we go into closed session. Are you ready for the question? Madam Clerk?
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Yes.
Commissioner Colson,
Yes.
Commissioner McLaughlin,
Yes.
Commissioner Nunley,
Yes.
Commissioner Perkins Williams,
Yes.
Commissioner Ward,
Yes.
Commissioner White.
Yes.
Motion passes unanimously.